pandemic was officially declared over last year, but that doesn't mean the virus was eradicated. Nationally, the U.S. is recording more than 5,000 COVID hospitalizations per week. Experts at Baton Rouge General Hospital gave me a small update.
So we're about a year out from the pandemic officially ending. What's our status in Louisiana with COVID?
So we've seen a decrease in COVID infection. However, probably over the past 3 weeks, from late June to now, we've seen a slow rise in our number of COVID patients.
And that rise, is there anything that you can attribute it to?
I would probably relate it to summer travel, people getting together. We recently had the 4th of July, which probably caused larger groups of people to come together than we probably typically do in the earlier weeks prior to this. And although we're seeing a rise in the number of patients that are testing positive, we're still not seeing volumes near what we saw when we were in the pandemic of COVID.
We're seeing about 5,000 patients per week being admitted into hospitals. And that number, when you think about it, 5,000 seems like a lot. But when you compare it to what we were seeing in 2020 and 2021, 5,000 sounds like a victory.
I would agree with that. And I certainly would think that the patients that we are admitting are much less sick than they were previously in 2020 or 2021.
So, about how many patients are you seeing?
Currently at our hospital, in the emergency department at Baton Rouge General, we test about 30 to 40 patients daily. About 2 to 4 of those patients test positive. Most, if not all of them, go home. At our urgent care facilities, however, we have seen an increase in the number of positive cases in the community. I think that speaks also to the decreased severity of the virus, allowing patients to go to an urgent care for help as opposed to the emergency medical center or the hospital.
So, it's not a ton of people being hospitalized. Is there anybody hospitalized at the moment?
We actually have one patient hospitalized, and although they're here with a COVID diagnosis, their admission was for something else.
Wow. Okay. So it's not even directly linked to the COVID illness.
That's correct.
Okay. And so whenever you're seeing these patients coming in, what type of virus do they have? There's so many different strains of COVID.
Sure. So still, Omicron is the primary variant that we're seeing from about 2022 of December to now. Their symptoms usually are that of the common cold, runny nose, maybe some shortness of breath with exertion, fever, nausea, vomiting, diarrhea is what we typically see. This particular strain has been with us since 2022 of December, but probably a variant of Omicron since probably early 2022, January or March. Prior to that, we had the Delta variant, which was less transmissible, but the disease itself was a lot more severe. This time
Right.
around, this time around, Omicron is more transmissible than Delta, but the disease severity is much less.
Is it fair to say now that the COVID-19 virus is similar to the flu?
Absolutely. I think, as with the flu, we are used to seeing that certainly during our flu seasons. I think with COVID, we're going to be used to seeing it. It's no longer a pandemic, we're endemic. So it's here to stay, but it's certainly not the virus, the monster that we thought it was back in 2020, 2021.
Right. And sometimes I do see some people with masks. It's very occasional, but I still see it. That's not something that's necessary anymore.
I wouldn't say that it's a necessity. It's personal choice. It may help somewhat with transmissibility, but data doesn't exactly support that. Here, currently, the CDC recommends that if you test positive for COVID, you quarantine for about 5 days, and then when you go back into public, you wear a mask for additional 5 days. Um,
Okay, so really a personal choice. I mean, I know that this has been hammered into the public awareness for years and years and years, but for the people that are still afraid to get sick, what can they do? Especially since Omicron tends to be it's milder than previous variants of the virus.
I think it's the same precautions you would take with the common cold. Washing your hands, staying away from friends or family that you know may have been exposed to the virus. Certainly, if you have high risk for severe illness, which is the same as that of the flu, patients that have medical comorbidities, respiratory issues, cancer, immunocompromised states, or the extreme of age, our young and our old population. But right now, I don't think anybody should limit themselves from normal activities of daily living. I think it's important to get out of your house, although the heat is certainly here and something that we're dealing with in Louisiana, but really no restrictions.
All right, so is there anything else people should know about the virus and its current status?
Not at this time.
Not at this time. That's good news. I remember at one point, everybody thought we would be stuck with this forever, and we've come such a long way. Well, thank you
Absolutely.
so much for coming and speaking with us.
Certainly. Thanks for having me.